Welcome to the Focus Forward Business Podcast for StudyMcKee.com.
Hey, welcome to the Focus Forward Business Podcast. I am Sturdy McKee. I'm here with Tiffany Shubert. Tiffany is a senior product manager at Relias and managing partner at Shubert Consulting from business. She used to be a research scientist at UNC Chapel Hill, and she is an expert on healthy aging and translating research into practical uses, which we all know we need. So thanks for being here, Dr. Shubert. Really appreciate it. Well,
Thanks so much, Sturdy. I'm really excited to be here too.
so we had a conversation last week that really spurred the idea for this episode, for this podcast. So today, if you're listening, this is going to be really focused on kind of healthcare sector and physical therapists, kind of in particular, but it applies really across the board to almost all services as we kind of think of them, and we'll tie that back in as well. But just a heads up, if that's not for you, skip to another episode. Thanks. So Tiffany, we were talking about like continuum of care, plans of care, those kinds of things. What kind of came up for you in that initial conversation?
Well, what came up for me was really, I think in healthcare in particular, we've gotten to this point where we just solve this one little problem. But if you just solve that one little problem, you're doing a huge disservice to the patient and actually to your profession as well. So it's all about, I'm going to solve this problem, but I'm going to look at how this little problem fits into that patient as a whole. Is it just the back pain? No, it's the back pain, which is now impacting their ability to do their daily activities, which is now impacting their quality of life and their mood. And so thinking about these things holistically is really important. And also making sure I'm giving my patient the tools that they need to manage their health and wellness so they're not going to come back to me.
Well, we want them to come back.
Well,
Just maybe not for the same thing.
right, exactly. Exactly.
Right.
Or right. Help them fix their own problems.
Yeah. Well, that's a thing too. So this has been coming up with clients of mine recently, several of them, like the mentality, not so much them, but the mentality of some of their staff and all. And I think this was true because here's a disclosure: we both went to UCSF graduate program of physical therapy, right? We were just a year apart. That's how I know Dr. Shubert way back. But there was a mentality back then, and it seems to still be hanging around for therapists to kind of get to 80% of recovery and then discharge the patient and let them finish on their own. Is that you? Are you still seeing any of that?
I am. And part of the reason why I'm seeing a lot of it is my area of expertise is older adults, which means that the therapists I work with are working with a Medicare population. And because there's a Medicare policy that's a little misunderstood, but that basically if a patient plateaus, the
Sure.
idea is that if they plateau, then Medicare will no longer pay for therapy, thus you must discharge them. To be honest, that is actually not the correct interpretation of that policy, but that is really the conventional wisdom around all of this. So we're actually not incentivized, really, to keep them until they really have hit their goals, which is a huge issue.
Well, except for our purpose, right?
Exactly.
Except for why? I mean, why did we go to PT school? Why did people go to medical school, PT? You name it.
Yeah.
Hopefully it was to get people better, not get them 80%.
And not get them to 80%, right? Because I mean, we always talk about, you have the great example of like, if you took your car to a mechanic and they said, oh, I fixed 80% of it, you'd be like, I don't think I ever want to go here again. Right. And am I safe?
Here's some tools, go finish it up yourself.
Right. Exactly.
No.
Exactly. And I think this is very interesting. And it took me a really long time to come to this realization, because we are taught that, that we're supposed to have evidence and that evidence drives what we do. And if we use the evidence, we can really get our patients to where they need to go. Right. And it's 100% true. I mean, I was in academia for 10 years. Let me tell you, we have a lot of research that proves that. But the problem is is that our policies actually drive a lot of what we do and how we're paid. And that really gets in the way. And I think we really just, and I think that's not unique to healthcare, to be 100% honest.
Right.
But I think that's what we need to start really critically looking at. Like, what is my value as an expert? Can I use my value and use my tools to get my patient to where they need to be?
Well, no, you bring up a good point because it's a lot of different industries where some policies will get in the way of actually fulfilling your purpose, doing the right thing. I think a lot of it, and I'll tell a quick story here, but I think a lot of it has to do with who you see as your customer, right? And if the patient ultimately, or the way my value systems work, the patient is the customer, and the payers and the system and all the other stuff is kind of ancillary to that. That's extra. They're considerations perhaps, but they're not the person I'm trying to serve and take care of. Now, the story is I was on stage in front of 150 people, at one of these conferences and talking, and we were kind of broaching that topic, the patient being the customer, and somebody raised her hand, and I was like, yeah. And she literally, in front of the whole crowd, and this is a business owner, practice owner in private practice, said the insurance company is my customer. And that just, I mean, honestly, I didn't know what to say at the moment. I was really fishing, trying to figure out what in the world, because anything that was going to come out of my mouth immediately was not going to be good.
Right.
Right. It was like, but ultimately, it's like if from a patient perspective, right? You're the person needing help. Do you want to go to a healthcare provider that says the payer, the insurance company, is my customer, not you?
Right.
That
Yeah.
just seems so disconnected. But so if we really focus on that patient being the customer, what is it we're trying to accomplish for them? Right? And you brought up another great point. And since we were trained in the same program, I'm pretty sure your experience was very similar. Um, we're taught that if we're the experts, if we have the right answer, people will magically just do what we say and follow.
I don't think that's unique to our program.
Oh, it's not. It's not. I've literally met one therapist who was trained at McGill University, we'll give them credit, in Canada, that said, oh no, we were taught, to go beyond that, to have the conversation with the patient. We were taught that in school. I'm like, wow, okay. But that's one person, right, in one program across all of, my experience with hundreds of practice owners that actually, had any formal training in that. Right?
Yeah,
So
it's a huge miss.
well, let's talk about that. What do you see? What would be more effective than, dictating, mandating to people, oh, this is what you will do?
Yeah, I think the key thing is really having an honest conversation about what is the role of the physical therapist, of the healthcare provider in
Mhm.
this process, and being very realistic of like, we might see our patient maybe if we're lucky 3 hours a week, maybe, over, cumulative 3 hours a week. Well, that's a lot of
Sure.
time that we're not with our patient.
Right.
So given that, what can you actually really impact? And what you can impact is giving the patient the tools that they need to engage with their therapy. This is a totally different mindset than, hey, you have to learn this technique. And if you do this technique, you'll fix this person. And it also puts the therapist in a very different role because before it was all on us, we're going to fix you. And this is, we're going to collaborate and work together and figure out what tools do you, the patient, need? What tools will you actually use in order to get better? And it changes everything. And it's unfortunate because healthcare in general in the United States is very hierarchical in the sense of like doctor fixes patient.
Mhm.
Not realistic, right? And now we've really got to get to this place of, hey, let's work together. And my job as a therapist is to figure out what is important to you. What are meaningful goals to you, not to me and not to my documentation, Is it
Right.
really meaningful?
Right.
Right, right. Okay, so we're gonna get your shoulder range of motion to 135 degrees.
So what?
And what? Yeah, right. So, um, but that does take some time. It takes a lot of humility. And also from the therapist perspective, it takes a lot of confidence.
That's a great point too, because we're conditioned, and when I say we, I mean all healthcare providers, all highly educated people. If you think about a PT today graduating, they've been in school for 20 years,
Hmm.
okay, at least, and they're 23, 24 years old, right? So they've been in school for 90% of their lives, 80% of their lives, and what I see is in school we're taught to be right and to do it by ourselves, right? I mean, if you were
Yep.
collaborating on an exam back in grad school, what's that called?
Yeah, cheating.
Right,
Yeah.
right. but but the minute we graduate, right, the moment you're done, it's a team sport.
Mhm.
You're never dinged for collaboration again. Actually, you'll get better results if you do. So no wonder we can't collaborate with a patient because we've been conditioned not to.
Exactly.
And I like what you said about humility and some confidence and stuff because a lot of self awareness has to come into it, kind of realize, hey, the playing field changed. So am I going to change my game a little bit? Because now we're dealing with real people who have issues, objections, things that, your ideal plan may not work for them. So how do you kind of manage those conversations? How do you approach that?
So I approach it a couple of ways. And the first way is just being brutally honest with a lot of humor. And because sometimes you talk about the things that we do and it sounds so ludicrous when you actually say it out loud, and people do actually giggle and go, "Oh my gosh, yeah, you're totally right. What was I thinking?" So having those conversations and then also modeling for people when we have these conversations with our patients, even though it might take more time in the beginning, suddenly all of those challenges that we have of like, my patient's not compliant. They never do their home exercise program. They're too old. They're too stubborn. They're too. All of those start to go away
Mhm.
because now you actually are starting to understand who this person is. And that's really why we got into this. We really like people. We want to help people and we want to help people live the lives they want to live. And the only way you can get into doing that is actually stopping and listening and letting the patient tell you what's important to them, and also setting it up so they can succeed instead of fail, because nobody likes that.
Right. And yeah, being curious. Right.
Yes.
So I don't know that this hasn't been done with PTs, I don't think, but specifically, but for medical doctors, I remember bringing back to my staff a number of years ago that there was a research study. It's going to be easy to find. You guys look for it on how often and how early physicians interrupted their patients, right? And they tracked like
Hmm.
800 something interactions or something like that. I'm probably getting the numbers wrong a little bit, but a
Yeah.
couple hundred doctors, and then maybe 20 doctors or something, 800 or 1,000 interactions, and they found that they averaged, I believe it was like 23 or 28 seconds or something that they interrupted their patient. They cut them off, right?
Yep.
And when they asked the physicians about it, none of them were aware at all that they were doing that, right?
Yep. And that was actually probably prior to EMR implementation, which means it's probably a 10,000 times worse now.
Yeah, 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 yeah. The
Hmm.
other the other thing that was so interesting about it though was if they let the patients finish. Do you remember how long it took them to finish?
Yeah, it's been a while, but
It was like
so
8 seconds. I mean, that's why it stood out so much. It's like 8 seconds.
yeah.
Like, well, I'm cutting off because I don't have time. We have to hurry through this. It took 8 more seconds.
Exactly, and they probably got a wealth of knowledge from those 8 seconds.
Well, and not just that, right? Rapport.
Mhm, mhm,
Is somebody more likely to follow you if they like you, if they
right.
feel like they've been heard?
Yeah,
So.
Exactly. Exactly. Well, and it is kind of interesting. I mean, I think a lot about of this stuff, and like I said, my current role is a product management role,
Mhm.
and it's actually helped inform a lot of how I think about patient care, and patient care has informed a lot of how I think about product. Because when you're building product, it's all about your end user, your customer, and
Right.
what is the experience that you want them to have, but then they have to validate every single piece of that experience. Otherwise, the product you're building is not going to work. Right. And
Right.
we have these same conversations in product management of like everybody having this idea. Oh, let's go build it and then we'll release it. And it's like, no, 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 no. Let's take this little idea and let's validate it. Let's learn what people think about it. Let's learn about the problem that this could actually be solving. So it's kind of a really interesting complementary experience I'm having.
Mhm. Yeah, if we don't think about the end user and how we're interacting with, whether it's the knowledge, the service, the product, whatever, how are we going to succeed?
Exactly. Yeah.
Sorry, my head's running a couple different directions. No,
Sorry.
no, it's awesome. It's all right. We'll edit this part out.
No worries.
Um,
Which direction do you wanna go?
let's take it back toward the patients, but ultimately,
Okay.
um, but yeah. Well, here, what should I ask you?
Um, so if we go back to the patients, I think one of the mistakes that people make when they start thinking more about holistically is they wanna use the same tool over and over again.
Okay, cool. Yeah, let's
Yeah.
let's go there. Yeah.
Okay.
So,
Alright.
Shania, if you're editing, so let's talk about adapting your practice, adapting the things that you're using. If you start thinking about things differently, a lot of stuff you brought up is really a shift in mindset, right? Perspective and prioritization and your role. So how can you really effectively kind of make that mindset start working for you if this is something a little bit new and different for somebody who's listening, practitioner?
Yeah, that is a great question, and I'll tell you what not to do, and then we can talk about what to do.
Mhm.
So a lot of times what I see, and I see this profession wide and individually, is that when people want to start, I realize that I'm not engaging my patient. They want to like grab onto one tool and use it for every single patient. And motivational interviewing is a great example. Like
Right.
motivational interviewing is fantastic, but that's what everybody's like. Oh, this is what I have to do. This is what I have to do. And it's like you can grab the bits and pieces of that actually work for you and might work for that patient. And guess what? If it doesn't work for that patient, you need to go back to your toolkit. So I think this whole issue of I need to do stuff differently. So now I have to be an expert in all of these different things. You really don't. You need to be an expert at listening. And as you said, being curious and figuring out this unique individual, given who they are and what's interesting to them, here's what I need to do to engage them and guide them. And I talk about this a lot, especially with older adults when we're thinking about like, we have to do a warm handoff with them when we're done with therapy. We have to make sure that they've got access to the resources that they need and they want to use to continue. And that means you've got to pause and listen and, hey, do you want to exercise at home alone? Do you want to go to a gym? Like these kind of things, because we just tend to be like, oh, you should go to the gym. Well, I got to tell you, in my experience, my 75-year-old guys, they don't want to go to a gym because they might be in a room with a bunch of women. They really want to be exercising home alone. And so they're like, no, I don't want to do that. And so the therapist is like, okay, fine. Well, you don't want to exercise. Well, actually, he does, but he doesn't want to
I know.
exercise in that environment. So it's just, if somebody just pauses and just goes, okay, so that's really the trick is just to, don't think about all of these things that you're supposed to do. Just stop and listen. And then if that's it and you need to go home and do some homework and then come back to the patient, that is okay.
So how can people get better at that communication and listening?
Well, I think one of the hardest things, but I also think this is it's kind of a easy blame game is like, oh, productivity. I have to be doing this. I can't stop because I won't hit my productivity goals. And I would definitely challenge that. Number one,
Yeah,
again,
isn't this
yeah.
still part of your treatment?
Yes, yes. But it's kind of like what you were just saying
Right,
about the physician study. Like, oh, I can't
mhm,
listen to this. I have to keep moving. And,
right,
and, you know, and I actually think having some peer-to-peer interaction of like literally having a colleague in the room or being able to give you some feedback of like, hey, I don't know if you realize this, but you started that question and then you turned away and you were writing your notes and you weren't actually engaging with that patient. Because it
yeah,
is hard to do on your own because a lot of this is stuff that's ingrained. Like, I mean, we've been in practice a really long time. We do things a certain way.
mhm,
But pausing, number one, really talking to your patient like you would talk to anybody like, "Hey, what's going on? What's important to you?" Like asking them questions about themselves and not about you know, this is going to sound weird, but I think we get really stuck on just like asking them about their pain and I've been a patient. It kind of gets old after a while. Like if you make me rate my pain again, I think I'm going to hit you. Like, is this really helpful?
right,
Obviously there's a problem. Can we not talk about that? Can we talk about how I can certain things I really want to do and how I can get to do those? And maybe we can talk about pain management along the way.
mhm.
So I think
Well
breaking from the script helps.
well, that's a great point too, because we've been, again, kinda education, and then it's reinforced that we're supposed to be solving the problem,
Right.
right? And we get so hyper focused on the problem at hand, the diagnosis, their post-op this, I already know what to do before they come in, whatever, and we don't allow time for the context, right? I mean, I
Right.
remember people used to ask, like, "What do you do for back pain?" I'm like, "I don't know. I mean, what's wrong?" Right? I mean,
Mhm.
people ask me business questions now similarly, right? And it's like, well, I don't know where you are. I don't know where you want to get to. We don't have a clear, definitive diagnosis or idea of what's, the problem. Like, I don't know what the intervention is until we actually go through and figure that stuff out, you know?
Right.
So, but, but beyond that, part of that context is where you are now, where you want to get to, but why? What's that going to do for you? How's it going to change your life? What's going to happen if you don't do it? All those and some of those kind of are like sales questions, right? But it goes back to being really curious instead of getting hung up on, oh, I don't want to do that because those are techniques from this other evil thing, right? No, you want to really be curious and ask and find out how's their life going to change? What's
Mhm.
the impact if they don't? And I heard this phrase once. I think it was Jay Abrahams who said it actually, but focusing on the transcendent power of what you do,
Oh, I
right?
love that. That's great.
Yeah, and that hit me right immediately because think about this for all the healthcare providers and owners of practices and stuff out there listening. What are the changes that you make in people's lives if you're effective? If you get them all the way
Mhm.
across the finish line, right? Older adults, it could be keeping them in their home, right?
Yeah.
Is that kind of cool or what?
Yeah, and it makes me a little it's a little sad about the fact that I'm
Mhm.
not sure how many of our colleagues actually get to have that experience of I got this patient across the finish line and here's where they are. And when it does happen, it's so fantastic.
Yeah,
And
it's awesome,
yeah, it's
right?
just like, hey, this is why I'm in this and I really have made a difference in this person's life.
Mhm.
And it's
But if we
huge.
Well, it is huge, but I do think a lot of it. I think that I see a lot of folks just kind of miss out. Like they're actually doing it, but they're so caught up in the day to day and the documentation and the rules and the procedures and all the minutia that they lose sight of the big picture and the transformative nature of what they're doing for their customers, right? Their patients.
Yeah.
And just stopping for a second and starting to tell some of those stories, reflecting back on if you discharge somebody this week, what can they do now versus before? And by the way, are you relating that back to the person along the way, right?
That
Just for the
is Yeah.
But- Well, for the patient, they're kind of staring at the clock, right? They're with their body all the time. They don't see the changes. So unless we
Mhm.
kind of, if you're a provider, you get to take a snapshot here and a snapshot here, and you can show them the progression that as soon as they see it, they're like, oh yeah, yeah, yeah. On last week you couldn't stand up by yourself without using, pushing up or whatever. You just did that. How's that feel? Right?
Yeah, it is one of the most powerful tools that is so underutilized.
It's the
It's
before after picture.
Yep, yep, and that continual progression, right?
Right.
Yeah, exactly. And I think especially in the older population because we do tend to be a little ageist in this world, and a lot of older adults don't really know that they
Yes.
can get better and they can get stronger. And when they start seeing that, it's first of all, they don't believe it. I've had so many
Mhm.
patients be like, "You're lying." And I'm like, "No," and I'll, like, take video to, like, prove it to them. "No, look,
Sure.
see the difference." And it's huge, and it's that objective data that's critical.
Well, yeah, now we're going back to you bringing research into practical use as well, because I remember, I can't cite it or whatever, it's long ago, but I remember studies on 90-year-olds in strength training, and that they can gain strength and they can gain flexibility. They can change, their body will change and adapt. It doesn't
Yep,
happen at the same rate as a 12-year-old, right? But it's totally possible. And just because I'm older doesn't mean you can't train, doesn't mean you can't change or improve your situation, kind of physically,
exactly.
movement wise and stuff.
Yeah, this is kind of funny. We definitely are contemporaries because I know the exact study you're talking about.
Mhm.
And what they did, which was so cool, was they took 30-year-olds and 90-year-olds and they put them
Okay,
on the same strength training regimen. And what they saw was that they actually gained the same amount of relative muscle mass, but when they stopped, the 90-year-olds lost it way faster than the 30-year-olds.
got
But
it.
kinda crazy, right? I'm 90 and I'm gaining the same amount of muscle mass as I did when I was 30.
That's
This is
awesome.
awesome. Yeah,
Yeah, yeah, but that also begs or makes the point that you got to maintain.
absolutely.
Don't
Yeah,
stop moving. Well,
right.
so how do PTs in particular connect with people on that level of this idea of you got to keep going, you got to maintain, because you brought up Medicare rules and stuff before, but isn't there a way for people to continue on a maintenance program, at least intermittently, to keep them on
Yeah.
track?
There is. It's a little nuanced in the sense of if someone is, let's say someone has a degenerative neurologic disease like
Mm,
Parkinson's or MS, then
yeah,
they definitely qualify for maintenance therapy because the idea is that okay, you've plateaued and you're probably not going to get better because neurophysiologically you can't.
mhm.
But if I keep seeing you once a week, I can keep you at that level.
So you don't deteriorate, you don't backslide.
Exactly.
But
Exactly. Exactly. Yeah, for those who are not don't fall into that category, um, certain cases it still applies, but really what our job again is to get to that older adult to a certain place and then assess what are the resources available to them, or actually I engage
right,
them really on to figure all that stuff out that they can keep going.
right, whether it's with us or not.
Yeah, yeah, and having the very honest conversation of you can get stronger.
Mhm.
But, like, when I always talk about falls as a chronic disease, like, the risk factors are not gonna go away. We can't just improve your balance and then let it be. You have to do your balance exercises every day, just as if you were a diabetic and you took your insulin every day.
Oh, I like that. So, yeah, talk a little bit more about falls, because that's such a huge deal that we don't really think about or confront as a society until it starts to happen.
Exactly. Yeah. No, it's a huge issue. And it's a really complex issue and everybody wants to try to fix it. But the fact of the matter is that actually we all fall down quite a bit. So we always talk about, oh, people over the age of 65, 1 out of 4 fall every year. Well, to be honest, the 40 to 64-year-olds are falling at the same rate. It's just that they don't get hurt at the same rate, which is kind of wild.
They're
I know it's
falling at the same rate, like when they're playing soccer or what?
Or just in general, it's a gravity issue. No, believe it. I mean, if you look at the demographics,
Yeah.
it's still 1 in 4. It's just people aren't getting hurt. Why are the 40 to 64-year-olds falling? Whole variety of reasons. Some are falling more because of recreational reasons. Some are falling because their job, whatever they're doing,
Oh,
and some are falling just because we just aren't super active as a society, and so we lose muscle strength and balance as we get older.
huh. I,
Um,
I didn't know that.
oh, it's
That's pretty
crazy.
interesting.
Yeah, yeah. When you start diving really deep, it's pretty fascinating. And then it gets kind of scary because there's a whole other body of literature that is saying, well, these 40 to 64-year-olds who fall in a non-recreational, non-work related, those folks are starting to be very fearful of falling, and they're starting to limit their activity,
Right,
which is
right. So
the
they do
abs
less.
yes, and now all of a sudden they're at even a higher risk of falling, which is a huge and then you're like, "Oh, no. This is the wrong direction." Um, but and then when you get to those 65-year-olds, and it's really 65 to pretty much late 70s, those folks,
Mm,
especially the baby boomers, they really have embraced physical activity
mhm.
in general. And so when they fall, there's less likelihood of them getting injured. But once you hit the 80 and over, those are the folks who really get worried about getting injured and potentially, once you have that injury, it really the outlook is not good.
Right, right.
So yeah, yeah. But from a PT perspective, the big education, well, first of all, you always have to do a screening. You've got to make sure it's not a medication related issue because
Right.
many, many times it is. It's not a blood pressure related issue. It's not any, you got to rule out all those things or you've got to refer on. And then you're looking at strength and balance and this whole issue of, hey, if you do strength and balance training about 3 hours a week, your chance of falling is going to decrease by 30 to 40%. And your chance of getting injured if you do fall is going to decrease even more. And when people start to understand that, then they start to really embrace it.
Right, right. Well, and again, think about what that does for somebody's quality of life, livelihood, you know.
Yep. It's huge. Yeah. Because what you don't want to have happen is have that person fall and then, or see their friends fall. This happens a
Mhm.
lot. Oh, all my friends are falling and breaking hips. I don't want to do this. I don't want to do that. And all of a sudden, that individual's world gets so small. And then they become less active and then they become at a higher risk of falling, and you want the opposite. You want them to be able to do whatever they want to do, not what you want them to do, but what they want to do.
What? No, you have to do what I said.
Exactly. And then it gets really fun because when they start getting stronger and they start doing all those things, then they start telling their friends, and their friends are like, "Oh, I could do this too." So yeah.
Right. Well, and that's the other thing about like
Yeah.
why I love sports and human movement and stuff is you can see it.
Yeah.
So I mean, you literally see it, right? Your friends will see that you're getting stronger, or you see that hey, Bob is suddenly doing more stuff and more active. What was the secret? Right?
Yeah.
It's not a magic potion,
Yep.
right?
Exactly. Exactly. Yeah. And when people have those things that are important, I mean, it's just kind of funny. I'm actually going to a 103rd birthday party in about a month.
Yeah.
And this is for a woman who lives independently in her home by herself, and she goes swing dancing twice a week. And in her mid 90s, she fell and broke her hip. But
Mm,
she has this incredible swing dancing community, all ages, and, like, that was her driving factor, and her therapist actually did listen to her, and even though they were like, "This woman is 96 years old, are you kidding me?" Like, they worked with her to get her stronger. She had to go to skilled nursing for about 3 weeks, but then she got to go home, and she kept on doing she was, like, 100% compliant with her exercises because she had that end goal in place, and she's still doing them, and she
mhm.
gets to go dancing. So, yeah.
Well, but you just said something. It's not just the dancing, right? It's the community.
Yes.
It's the
Mhm.
social, the mental. I mean, so many implications from that. I think we lose sight of that very often too. It's like,
Yeah.
oh, they want to play tennis. Well, that's not something that'll be covered or da 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 da.
Right.
It's so important because that's their whole social scene. That's
Yep.
where their friends are. You know,
Exactly.
want to get a runner back to running, half of that is because of that's who their community is.
Yep. Exactly. Exactly. And again, to take the blinkers off and be like, the blinders off and not be
Mhm.
like, well, here's somebody who's this. So, why would they go back to tennis or they can't go back to
Right.
tennis or they can't? And it's like, no, if this is this person's passion, open the door for them. Show them how they can, even if it's modified, whatever it is. Yeah.
Sure. Yeah. 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 No, I love that. Okay. So is there any other thoughts you'd like to leave our audience with?
I think we've covered a lot.
The, on- the only other thing I think we didn't go into great detail on was that initial buy-in. We talked about the conversation, kind of talked around it, but one of the fundamental things about that conversation that I think really that's super super important is having the conversation, really listening to the patient, as you already said, but then getting agreement
Yes,
to the plan,
absolutely.
right?
Yes, yeah, absolutely, you are exactly right, and that is so critical. And because when you do that, and I like the written agreement, just but I'm a very, that's
Well,
sort of how I learn and how I am. But yeah.
well, I like writing it down as well. There are a lot of people who have their patients sign it.
Hmm.
I never liked that, and part of that too was our target customer. When I was running clinics here in San Francisco, and the financial district having people sign a piece of paper that their plan, they just you know that wasn't going to happen.
Is this an NDA?
It just wasn't gonna fly, right? But having, verbally agreeing, writing it down, and then handing it to somebody, that worked really well. So there's gotta be some version of that. But again, we're kind of full circle back to who's your customer and what's gonna work
Hmm.
best for them. And how are
Right.
they gonna, what are they gonna adapt and adopt, and what's gonna inspire them, not just motivate them. We're not trying to, run behind them and keep them going. We want to inspire them so that the drive is internal. I mean, that's the same for your staff, your employees, and the rest of it. If you're having trouble like implementing these changes, why'd you go into healthcare in the first place?
Exactly.
How
Exactly.
can we better do that?
Right. And the beautiful thing about having that agreement is that you are demonstrating to your patient that you have listened and you're giving
Yes.
them an opportunity where you're feeding it back to them. This is what I heard you say. Here's what we, and it gives them a chance to go, you know what? Actually, I think I want to do this instead. Or I think
Mhm.
it gives them all of a sudden this whole other way to totally buy into things in a very engaging way because they get to own it.
Well, exactly. You're giving them power.
Hmm.
You're giving them back some control, which is I well, my opinion is it's not done nearly enough in our healthcare system, but kind of generally.
Oh, absolutely. Yeah. No, healthcare is 100% disempowering if you're a patient. Yeah,
It's it's terrible sometimes, isn't it?
it is. I wish it wasn't, and like, I mean, and I have some amazing healthcare providers, but when you
Yeah,
get really sick, uh, yeah, you lose a lot of control, and it is not good. So,
yeah, no, for sure. So, okay, well, on that
on
positive
that
note,
happy note.
well, the positive part is if you are a healthcare provider, you you have uh, you have a lot of control over that. You
Yeah.
can definitely make huge positive changes, for your patients and for your colleagues. So,
Exactly, exactly. And again, I think even taking small steps in this
mhm.
area, because honestly, the bar is not very high, you can make a
Right.
huge difference. And then as you get into it and get more comfortable, you can do more. So yeah.
So here, last thing, as a patient, right? Because we're all patients at some point, no matter who
Mhm.
you are. What what can you do to foster, to facilitate maybe some of those communications that you want to be happening that maybe aren't?
That is a great question. I think it's really, really important that patients can ask questions. So I think it's really good. Like even when you're making your initial consult or your appointment, asking, "Hey, do you have a PT who has expertise in?" And seeing if there is that that loop. And if, it's not the PT making the appointment, but if the lady or the man at the front desk is like, well, actually, yes, and da 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 da. That to me is a really good sign because all of a sudden, if you can ask questions and get an answer, that means you're going to be in an environment that's more open to having a question, to having those conversations. And I also think it's great to just basically be like, can, I know you have goals and I have goals. Can we make sure those goals are the same?
Right.
So,
They're
yeah.
lined up, right?
Yeah. Yeah. So just being empowered because I think again, we're sort of gotten a lot better, but
Mhm.
in general, we don't have a lot of opportunity to say this is what's important to me.
Yeah, and I mean, write down your questions, right? Bring an advocate or
Yep.
something. But what you just said too really resonated because I immediately thought about my youngest son plays soccer, hurt his MCL, went to see the doctor, and we didn't ask this ahead of time. The system was kind of assigned to him, but the physician who saw him play Division I soccer, in college, and really related, and because of that rapport and the understanding for him at 13, right? It was like, oh, he listened, they were engaged, on both ends. So it was a
Yep.
much better interaction. And the relatability piece was there and it didn't feel the same way as some other interactions we've all had.
Absolutely. Absolutely. And it is okay to shop around a little bit. It's absolutely
Really?
fine. I know. Because then you're going to find the really great people that have worked with Sturdy. And,
Wait, they're not all the same? Yeah, if I hear another person ask who their surgeon is, whatever, and they say Kaiser, I'll lose my mind. Um, because I mean, that's
Yep.
not that's not
That's
how
not
you pick a lawyer or an architect or come on, that's
exactly.
they're
Yeah.
individuals. Yeah.
Yeah.
Okay. Well, that's a much more positive note to wind down on.
Thank you.
So
I think so too.
cool. Well, thank you so much for being here, Dr. Schubert. Really, really appreciate it. And hope you have a wonderful rest of the week.
Thank you so much. This has been great, Sturdy.
Thanks.
Thank you for listening.